Dr. Terry Loong. Okay, first of all, your name is gorgeous, and I wanted to make sure as we start the podcast that I pronounced your last name properly. And can you please tell me and now all of our listeners and viewers what your last name means?
So my last name Lung, it means dragon, and my Chinese name Pui Feng actually means phoenix.
Oh my
So I yeah, so I actually have like in the Chinese culture, in dragon is like the masculine and the phoenix is the feminine. So in you need both in partnership. That's why in marriages you always have those two mythical creatures as a symbol in in decorations and everything. So that's kind of
Okay. I mean, this is what a killer start to what I already know is going to be incredible conversation because I mean, you just hit my heart. I mean, first of all, the Phoenix. I love the Phoenix. Love the dragon too. The Phoenix is that feminine energy, that force. And then for you to talk about the masculine and the feminine, which is so integrated into everything in my brand and my life really. I think that just sets a beautiful table for us to start talking about beauty and health and how they really do work together. So for a little bit of context for our and viewers, can you please just get a little background, because you're a doctor, you specialize in hormones and face aesthetics. I've been wanting to talk to someone in your field with your
Mhm.
expertise. Very specific, though. I really wanted to speak to someone with your approach, this more holistic approach, because first of all, that's Black Belt Beauty is a holistic high performance lifestyle brand, right? And so even how I approach beauty, it is this holistic approach. It's the inner and the outer. So I was so excited to bring you specifically onto the show because I know that you can, carry this conversation well and talk about beauty from that perspective. So back to my original question, if you can just give a little bit of context to our viewers and listeners, your background and how you really arrived to be where you are currently in your career.
Fair enough. Thank you so much, Roxy. I mean, number one, I just want to say when you approached me to invite me to your podcast, I was just blown away because I love your brand, the whole thing about, female empowerment. And like you say, women can be beautiful, but strong, so people
Yes.
always think strong is kind of very hard. But again, strong is also feminine and soft and flexible and
Yes.
fluid, like water, like fluid. So
Yes.
a little bit of my background. I actually first never wanted to be a doctor. I wanted to be a dancer actually when I was younger. And then when I was 16 years old, I decided I want to be a doctor because I grew up kind of a bit on the chubby side. I was very dark. So growing up in Malaysia, I was bullied a lot. So I always call myself like the ugly duckling. And so when I decided that, okay, I'm going to just focus on my brain. So 16 years old, I decided, okay, I will be a doctor. Then I became the first doctor in my dad's family and the first female doctor in my mom's family. And then I went to become a surgeon first. So I trained as a surgeon. And then in 2007, there was a few things that happened in my life. I decided that surgery was not where I want to be. I mean, we didn't have social media at that time that we could look at, female surgeons who are
Mm.
influencers now that, have that good work-life balance and, have a stable relationship. By the time I saw female surgeons with a divorce, having affairs and never seeing their children. So I thought that's not what I want to do. So I left surgery thinking, and I left hospital medicine thinking, what should I do? So one of my friends I met to say, why don't you do a Botox course? I totally did not know anything about that. So so I thought, okay, I'll look into it. So I did the course, and then it was transferable skills, technicals that it comes easy for me because I was a surgeon before, quite easy with like small minute
Hmm.
kind of techniques. But then I would spend an hour with a patient wanting for Botox, 1 hour with a patient. I mean, like, who does that, right? Who
Yeah.
does that? But I love listening to their stories. And I always found when someone comes with a line, it was never just a line. It was talking about her life, her fears, going through maybe divorce, maybe going through change in, I don't know, the children growing up,
Mhm.
losing identity, and then then I got interested in nutrition. And then when I was 30, I had quite a few health issues, and I
Mhm.
had early stage cervical cancer. And
Mm.
then it just threw me in the whole field of functional medicine. I went to the
Yes.
States to study functional medicine, and then I went to study kind of bioidentical hormones, hormone balancing. So I started incorporating that into my work, and I started seeing lots of patients with skin. And then I wrote my first book called The Hormonal Acne Solution: How to Clear your adult acne without birth control pills,
Mm.
antibiotics, or Accutane. So that was kind of like my first, I don't know, my PR agent at that time say that, that was my first kind of, people know me for that, really, for
Sure.
hormonal acne. So, and then slowly my patients grew with me. So in their 40s, so I'm early 40s at the
Mhm.
moment. I got a 5-year-old son. So my patients now, slowly changed to women in their 40s going through perimenopause,
Mhm.
menopause. So I'm always very fascinated about that, kind of like duality, the Eastern and Western part, because I myself, I lost my mom when I was 19 years old, just
Okay.
3 years, three weeks of starting medical school.
Wow.
So I grew up in my 20s without a female role model. So I was very
Mm.
hard at the
Mhm.
time. So I had to learn a lot. And so it was just, yeah, yeah. I mean, now it's just continually learning, really. It's
Uh,
never ending.
Never ending. No, that's such a powerful story. I mean, and there's so many aspects of it where I really do relate. I mean, first of all, let's just also say this. We are both, I think, Gemini horses. Did we?
Yes,
Yes.
Gemini
Yeah.
also.
So,
I know.
so,
I love it. Funny, we were
so
born the same year.
I know that's so powerful. I love it. I'm 10 days out from my birthday and,
Oh.
I'll be 43. And so, even just that point where you are so, you're the decades of the 40s and perimenopausal and menopause. I mean, that was also very interesting for me. But going back to what you were saying about the, spending an hour with a woman who comes in for Botox and it's never just a line, there's so much more depth
Mm,
there. I relate that to, like, I can connect with that when I started doing makeup over 2 decades ago. It wasn't, I'm an artist and I do, like, I love your fuchsia lips right now. Fuchsia is
oh,
like
thank
my
you.
favorite, it's like a my brand color. But it wasn't, while I do love playing with the actual makeup and colors and textures and the art form of it, that wasn't how I started. It was, or I rather, it wasn't why I started, I should say. What really drew me in was this connection that I felt with the women that I was working with and what I was able to do for them emotionally, psychologically, by just, expressing some creativity through this medium that was makeup. But it was really
Mm,
the connection with the woman. So,
yes.
again, yeah, I totally understand how that could have pulled you in deeper to, to then go further down that, pathway to then become an expert. And this is a core part of your practice, right?
Yeah,
Yeah.
absolutely. Because like you say, a line, people see the line, but there's a story behind the line.
Yeah.
Really, so
Yeah.
what caused that woman to have the line? And
Right.
sometimes, people always talk about, is it vanity? I've got patients who come and tell me, say, I don't want to be vain. I don't want people to know. But sometimes they come because the story that they tell themselves that caused them to have the line, it's time for them to let it go,
Mm,
really, so maybe
that's
it's no
powerful.
longer it's no longer serving them, so they want to get rid of it or reduce it,
Yeah.
if you like, so that it doesn't keep reminding them of whatever the hardship they went through, or they feel that, okay, my story is I've already passed it, I've already processed it, it's a new chapter. So that's why I
Yeah.
want to reduce a line, just because it's no longer my story.
I love that. And when I think about, how you mentioned like the Eastern and the Western, you love that. And obviously I love that approach as well. And I'm just thinking right now, I'm like, wow, when we think about face aesthetics, like
Mm,
anything like Botox, fillers, and these things, I mean, I kind of put that in the Western, you know, surface. Like we're gonna handle this on the surface, right?
yes,
But the Eastern is root cause, right? It's
yes,
root cause medicine. And we
yes.
always, and this about me, and so do my, so does my community. I am an working from the inside out kind of girl, right? So but I have so much respect. I mean, there's a time for Western as well. I mean, it's not, I'm not fully connecting, everything to be in that category, but I am saying that, because one of the things I want to talk to you about as well in this conversation is that psychological, emotional component that comes with aging. And, I think we're in a really interesting time because, I was just having this conversation yesterday with one of my best friends about how, all we see now is fillers, Botox, filters, and we don't really see, like in
Your
my
person.
growing up, right. And at least, in my age, I have reference to aging, like women who I've seen age beautifully and gracefully. But I just think about the younger girls coming up and all they see is this just, surface. It's what's fake. I mean, it's fake,
It's
which
I agree with you.
please.
Yeah. I mean, it's like you say, the the influencer, the TikTok, different
Yeah.
filters, I'm all for enhancement. I mean, makeup is a form of enhancement,
Yes.
beautifying and everything, but I think, and it's so everyone has a different reason for it. And after a while, sometimes beauty, again, eye of the beholder, different perception, what is beautiful. And it's all about harmony. I always call it global facial harmonization.
Mm,
Okay. So it's kind of like, not every woman can do with big lips. Not every woman can be, sharp nose, and it's kind of like, but I, I prefer women to be more upfront with what they have,
mm,
really, so you see a lot of celebrities, and I've seen some patients, who have very big following, and they
yeah.
have Botox, but they say, oh no, it's just it's just my skin peel, or my or my
Right.
facial oil, and then it gives a false impression to the
Right.
community, because
Right.
then they feel bad when they apply it, it doesn't work, then they feel the problem is with them,
Right.
so as long as they're upfront with it, then, and there's nothing to hide, then, I mean, I have treatments, I'm not ashamed to share
Yeah.
my
Sure.
community and
Yeah.
everything.
Well, no, I think it's beautiful to own it. And, it's probably a good place to insert this. Like, I truly have judgment against this. I mean, I'm a beauty expert and, I've never done anything to my face except a
You're still
hydrofacial or just
gorgeous, you're still
thank
gorgeous.
you. I mean, listen, like there are some things I'm like, there are some things that, look at that. Like collagen is
You're
breaking.
fine.
No, well, I will give myself some credit to say I feel like I'm doing a great job to be
Mm-hmm.
a woman in my 40s and to just be relying on lifestyle. Now,
Yeah. Mm-hmm.
am I saying that I would never do it? I can't say that because I actually don't know. I mean, there are times where I look in the mirror and I'm like, girl, you look tired today. What if, for those who aren't watching and like just tug at the face a little bit, pull it back. But I'll end up putting my fucking hair in a ponytail or bun and it's like an instant face.
Yeah.
That
And
helps.
like you,
Just so you know, that's a
that does
natural.
help. Absolutely, it does help. Or
So,
tape, or tape
or
in certain areas.
oh my gosh, tape is a real thing. I remember that in
I know.
makeup, like some girls had tape. I was like, oh my
Yes.
gosh, it's a real thing. Yeah. So, but I just want to I want to say that because, there are a lot of women, I mean, my friend, like people who do that. And I get it because, we just want to feel good. We want to feel, who wants to walk out the door and not feel beautiful and feel like they look great because it does.
Yeah.
And this is why it's so built into my brand. It's look excellent, how it starts is feel excellent, look excellent, perform excellent. Because the truth is
Mm.
that if we don't appreciate what we're seeing, if that doesn't feel good,
Yes.
it affects how we feel and that affects how we perform.
Agree. Agree. And as we age, whether we like it or not,
Hmm.
okay, with the hormone changing, the
Yes.
face goes south.
Right. Right.
It's just, it's
I
just,
just like
it's just,
it just
in,
starts falling.
it just fall. I always say it's gravitational descent. Basically.
You are such a Gemini. You've got such great like little pithy statements of words. I love it. Oh my
So,
goodness.
so it's a gravitational descent, which then makes you look tired, look
Yes.
sad. And even though you feel great about yourself, what you're seeing in the mirror, and we all know, what you see, you feel, and
Yes.
no matter how much you tell yourself, yes, it can work up to a certain point, but after a while you see what you see, then you're going to be critical, so
Right.
it becomes like a negative loop. I mean, you know about the positive facial mirroring exercise.
No.
Have you heard of that?
Nope.
So there was a study that looked at what's it called? What did they call it? Candidates? Yeah, yeah,
Yep.
yeah.
Hmm.
Subjects. That's right. Subjects. Yeah. So they
Yes.
look at subjects. They put a pencil on their mouth so that to assimilate, to practice. Yeah. To assimilate a smile. Okay.
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 Yeah.
So to assimilate a smile, and then they measure how happy they were when they're doing a stressful a task. So they were saying that if they are smiling, then they are less stressed when they're doing a stressful task. So
Wow.
they were saying that, is it because you look like you're smiling, so then that you're happy, or it
Mm.
tricks the brain that you're happy, so that you have a less stressful response.
That's amazing. And I have heard, not the specifics about the pencil. I love that. But I have heard studies, that have done this where, people have, when you're smiling, it literally evokes that energy. And so
Correct.
it's like it lowers your stress levels. It's like
Correct.
it's interesting. That also makes me think about, something that you and I touched on in a conversation, where you talked about your skin cells can actually hear you, if I'm remembering. Can you
Yeah.
talk about that? That's fascinating.
So there's a Japanese professor called Dr. Mitsuhiro Denda, and he wrote a book called The Skin is Thinking, and also The Third Brain, which he refers to the skin as the third brain. I think it was published back in 2013, so it's quite new, if you like. But the book is purely in Japanese, and so, but I have a neighbor who's Japanese, and she's helping me buy the book so that I can translate it into English. But snippets that I found summaries from, from Mr. Google, if you like.
Mhm.
So what he says that the cells, the skin, so he's got three layers. We've got the epidermis, the top dermis, and then you've got subcutaneous. So epidermis, which is the top layer, people always think it's the dead layer. It's a protection, but people think it's a dead layer. And the dermis, you've got the collagen, elastin, the subcutaneous is the fatty area. However, the epidermis, what they found is, that actually it has cells, that memory cells similar to what you have in the brain.
Wow. That's
So in a
incredible.
way, yeah, so in a way, so the cells, the skin can remember, different touches, So think about, when you're friction,
Yep.
when you're running, or, when you're putting weights, you're going to get calluses, right?
Mhm.
So it clear. So if the skin doesn't have memory, it's going to regrow normally, and it's always going
Right.
to get sores, but it has memory. So that's why I know, okay, the pressure, same. Okay, it's going to build like a thick skin, if you like,
Right.
So, and also they were finding that, I mean, we also know in the skin, you can actually produce hormones in the skin,
Wow.
so
Wow.
skin is a target for hormones. So as we know that, but
Mhm.
it also produces hormones, and it also activates and deactivates hormones as well. So
That's
in its
fascinating.
so in itself, the skin is an endocrine organ.
Wow.
Yeah.
Yeah, I mean, I've definitely heard, skin is the largest organ, but to know that it's an endocrine organ, that's
Yeah.
fascinating. That's like what I learned about the muscle from, my girl, Gabrielle Lyon, Dr. Gabrielle Lyon, like the muscle is an endocrine organ. It's fascinating.
I know.
So then, when you look in the mirror, and if you're thinking, if you say to yourself, like, ugh, I don't look good today, is
Correct.
your skin, yeah,
Your
absorbing.
skin, your skin absorb it, not only just the words, but vibration as well.
Mm,
Because think about vibration on the mirror, it happens. There was another study by another Japanese researcher. I love the Japanese. They're just so, so advanced in this.
sure.
I think what's his name? Dr. Emoto. Dr. Emoto. I can't remember the first name. Dr. Emoto. And he did the rice experiment, and he looked at three. So he put rice in 3 cups with
Yeah.
water,
Yeah.
and the first cup was putting positive words every day. Okay,
Mhm.
saying positive words like "Thank you," "I love you," "You're looking beautiful." Second cup, very negative words. Why you're so stupid. You're horrible. And the third cup, completely ignore. Okay,
Mm.
so after 20 days, you want to look at what happens to the rice. So the first cup, which has positive words, okay, thrown at it, it was still white, but fermented into a very sweet smelling smell.
Mm.
The second one, which was very negative, it was rotting, very smelly, and was all black. The third one, it was completely ignored, also rotted and in black. So again, it's kind of like positive is one thing, but the negative and completely ignoring is another.
Wow.
So it's kind
Wow.
of like the words has such a big role to play in what your cells will feel and do.
That's incredible. So,
Mm.
so fascinating. So cool. Okay, that bridges my curiosity where I have a million questions waiting for
Okay.
you. Where I want to ask you, it's like, be ready. Here we go. I want to ask you, in terms of loving your skin from the inside out, when
Mm-hmm.
you hear that, what does that look like in application? And also knowing that, every stage of we're focusing on women, but obviously men have skin too, but just to make this easier, because I do want to talk about cycle syncing with your skin as well. We're going to focus on women here for the time
Mm-hmm.
being, and knowing that every decade, in a woman's life, her skin's going to be going through different things. But if you can give a couple of universal applications that relate back to loving your skin from the inside out, what are those applications? Food, rest, whatever it is, please go for
Okay.
it.
So I would say, the skin is a reflection of your internal health. And
Yes.
whatever problem that your skin comes up with is a signal for you to pay attention to your body, whether it's to your physical body, your emotional body, or your spiritual body. So it depends. And it depends how sensitive your skin is as well. I know when I eat bad, my skin breaks out. If I'm having stress, my skin breaks out, it comes out in a rash. So some people are not so sensitive, but some people, their skin are very sensitive in showing out, really. So
Yeah.
that, so they wear their emotions on their skin. So I think with what my impression of loving your skin inside out is actually loving all of it. Back in 2014, before I wrote the book, it just an epiphany came to me that the skin is an extension of your soul.
Mm.
So it encompasses your physical body, but it's an extension. You feel things, so
Yeah.
you're nearing somebody, but you can feel their aura, they can feel their energy. So it, there is soul work, if you like,
Yeah.
and your skin can feel it, skin can feel the vibration. So it's just an extension. So when I say loving your skin inside out, it's like, in a way, loving your soul. I mean, it's that's why my patients, when they get to know me, I always tell them, okay, I do have a woo side,
Yeah.
so some
Yeah.
patients, yeah, so I'm very careful. I mean, some of my patients who are know me for a long time, then I'll share more of my woo side, because
Yeah.
it's difficult to explain straight away, if you like.
Sure. Well, and I mean, it's all, these labels, woo woo. It's always an interesting label to me that
Yeah,
I kind of roll my eyes at. I'm like, are we just talking about being one with the force of life? Which that might
true.
sound, but I'm like, to me, that's very logical. Like, what, you know, we're all here integrated, everything is connected.
Yeah.
So I love that you have that about it. To me, that makes that I trust you more for that reason. Um, I want to say that, the part about the soul, the epiphany, it's profound and it really does make a lot of sense to me. We all know the individual who, we see and they're just radiating vitality. Just they have a
Yes.
radiance to them. It has nothing to do with makeup. It has nothing to do with their face work or it's an energy that some
Yes.
people, and then we know the opposite of that too. We've all seen the
Yes.
person who looks dull and like not really here.
Yeah.
And so to me, that is a direct correlation to what you are saying, that it is our skin does really exude deep, deep, deep parts of our being. So I
Yes.
love that you,
I mean, think about, when we're in love, you're gonna
yes.
glow, really,
Right.
and but when you do that, you are so sure, confident, and safe. because somebody loves you and you love that person. So, and
Yes.
then that's, but then, so, but if there is no body, but you have that feeling, why
Yes.
wouldn't you glow in the same way? Really,
Yes.
So
Yes.
that's
It's
was why I like to, when I, it changed the way I approach skincare,
okay.
and that's why in the Eastern world, when they apply skincare, how they apply it is so different from how the Western
Oh
apply
my
it.
gosh, I love that you're talking about this because I have questions about literally about application. Please expand on this.
So I mean, I think the Eastern women, I'm gonna go women because that's majority of my patients anyway, my clients.
Yes. Yes.
Eastern women, it's actually a ritual. They make it a ritual. It's their time, it's me time, no matter how busy they are, whether they're mom, whether they're working woman, and the mothers teach the children, teenagers about skincare.
Yes.
Okay, do this, do that, but it's kind of like there is a care for the skin. You're caring for the skin, so it's love really for the skin.
Yes.
Compared to Western, it's like, okay, I need to strip it. I need to,
Sure.
I need to, kind of like, um, I don't like the breakouts. I need to strip it with all the oils. I need to like renew it. Keep renewing. I need to peel it. So it's. I'm not saying everyone. I'm just saying a very generalization.
Sure.
So it's just a generalization. So so with Western women in the Western world, I in a way have to teach them, okay, don't overuse products.
Mm.
Use them, as part of a ritual rather than a thing to do. So it's much they take it more like, oh, it's just another chore,
I was
and when you're
just thinking that it's like a
yes,
chore. I got to wash my
it's a
face before
chore.
bed.
Yeah,
Yes,
absolutely.
girl.
Or I have
You,
got to I've got to do a mask, so it's like, but it's caring for you. It's like giving your child a hug. Is that a chore? That kind of thing. So it's kind of like, so it's a different approach. And I feel that, like you said, there are loads of skin brands out there, some good, some bad, and there will be more great ones that's going to come up. So I
yeah.
always tell my patients, like, the skin brand, yes, it's important because ingredients and everything, but how you apply it is also important. How you use it and not keep changing. So I see so
Mm.
many women change their skincare so often because they're not giving
Right.
time for it to work with the skin, how it works. So, and not slapping all in one go, so it's kind of like, don't see it as a commodity, but seeing as it, to support your skin, support you. It's like nutrients. It's like what you eat, you're supporting your body rather than just, it's kind of like you eat to live or live to eat.
Right.
So,
Yeah. No, it's so good. I love that. Because for me, it really is a ritual, and it's interesting, my mother, she was very, very good about, teaching me about skincare and, providing the tools, the products, growing up to be able to, for me to take good care of my skin. And, and in high school, I mean, a long time ago, I mean, I had skin issues. I've throughout my life gone through acne. I've had cystic acne. And now, with all that I know about biology and yeah, all of it, I'm like, wow. It's almost sad to me because I'm like, I know where so much of that was coming from, but I had
mm,
no idea back then that the
yeah,
gluten and the dairy, I was inflamed, and
yeah.
so, but, that being said, skincare has always been not a chore to me. It's been a ritual. And now, especially in my, oh my gosh, in my 40s, it's like, I I love I'm a double washer with the gentle cleanser in the shower. I'm a shower every girl kind of night,
Oh, sure.
Yeah, I got to shower before my bed. But I still want to ask you this question. It's funny. And then I want to get deeper into skincare
Okay.
specifically. Uh, is there like, I pat my products,
Yes, fine.
but does that make a difference? Because first it's just like, but like it just feels better. When you go to the spa and
Yeah.
they press it into the skin,
Yes.
and it just feels like, I mean, I guess that goes back to the ritual. Like, I want to feel like I'm at the spa when I'm doing my own skincare,
Yeah. I love it.
It's not
The
'cause
reason
I'm
why,
rushing, but
no, I know, but the reason why they pat it because they've done all the, manipulation and kind of like the, what's the word called? Oh, what's the word called? manual labor, massaging
Yes.
your face,
Yes.
stimulation. So
Right.
after that, once you've done the exercise, then you pad, basically.
Got
So
it.
it's
Okay.
similar like you're exercising, cardio, strength, strength,
No,
strength.
no,
Then
it's
after that,
like
you're stretching.
stretching.
So
Okay.
patting is like stretching. Okay.
I love that.
Zen, meditation, patting. Yeah.
It's so good. Okay, let's dive in to some skincare because I know our girls are like, tell me the good stuff. Okay, so let's talk about because I do want to talk about skincare products, but I really do want to talk about the aesthetic stuff with you as well.
Mhm.
Let's start with skincare. So, what would you say are some of the key, like we have retinol, we have vitamin C, hyaluronic acid, a recent ingredient that I've fallen in love with. I'm going to say this
Mhm.
correctly. Niacinamide.
Niacinamide, yeah.
Yeah, nice. Oh my gosh, that's a really powerful one. I'm like, whoa.
Yeah.
Okay,
Vitamin B.
vitamin, yeah. So can you talk about some of your universal, and this is essentially just to keep the skin in optimal health,
Okay.
what those ingredients are, products? Yeah.
So, okay, let me just think how to. So, okay, so in terms of like optimal skin, you want to make sure your epidermal barrier is intact, so that it's nice and plump and it kind of protects you from the environmental triggers, keeps your moisture and um, kind of protects you from UV damage. Okay.
Hmm.
Now, because of overuse of acids, peels, two active ingredients, the epidermis can thin.
Mm.
As we aged, hormones changes or depletes collagen, then also depletes as well. So from the age of 25 to 80 years old, your skin thickness actually reduces by 30%.
Got it.
In your menopause, the first 5 years of menopause, your collagen actually reduces by 30%. And every
Oh,
year, your elastin drops by 1.5%.
gosh.
I know.
It's like nature,
I know.
thanks.
I know.
Like the
This is why
fast track to just like,
it's
that's
like
like, uh,
gravitational descent. That's it.
hair back.
So I always tell my patients the first thing you're gonna do, make sure your epidermal barrier is intact. Okay. So I have like three parts, if you like. So first one is reducing inflammation. Second is making sure or maintaining the epidermal barrier is intact. And then after that, you can encourage kind of healthy regenerations with, all the active ingredients. So each part has its role depending on where you are, if you like.
Got it.
Okay. So if you have acne, reduce inflammation, rosacea, reduce inflammation, sensitivity, dryness, reduce inflammation. Always start with reduce inflammation. You can't go wrong if you reduce inflammation. Same with the body. If you
Mm-hmm.
don't know where to start, reduce inflammation. You know,
Totally. It's
it's a
amazing.
start. It's the start of everything. So
Yeah.
reducing inflammation, I mean, at the moment, niacinamide is a big word, but it's one of the very good ones at the
Mm-hmm.
moment. Vitamin B3, you can get it as a serum, a cream, or a mask. Because I use a niacinamide mask
Mm-hmm.
as well. So I like using that, and you can sleep overnight with it. And then in the epidermal barrier
Mm-hmm.
repair, okay, so you want to make sure you've got the ceramides, the cholesterol, and lipids as the cream. So then the skin cells can kind of encourage itself. Vitamin C can help as well because it's also an antioxidant as well. So it kind of protects it, sunscreen as well. Hyaluronic acid, yes, a part of the reducing the inflammation, no, the maintaining the epidermal barrier. And then the encouraging healthy regeneration. You've got your acids, you've got your retinols,
Mm-hmm.
so different parts of it. So you don't need a lot of products, but you need some really good products, really.
Right.
So again,
Um,
you want to have a good product, and every application you use, you're going to maximize the return of application.
sure. That's amazing. Okay, no, it's so helpful because I think it is so overwhelming.
Yeah.
There's so much out there. So my goal was like, okay, what are some of the main ones that you go towards that, because for example, retinol, I think universally is just understood that that is one of the most powerful cell
And
regenerators,
right.
anti-aging, you know,
Yes.
ingredients, and we've evolved so much with retinol, right? It used to be very
Yes.
scary, but there's
But now the formulations change now. So you got slow release formulations, so you can get very high concentration in slow formulations. So it's better for sensitive skin. And but with retinol, I always still recommend once a week because I've seen women use it too often and their skin becomes very glassy and thin.
Oh, really?
Yeah.
So you know what I just started using? I've used retinol for years, and I've gone in and out of different ones. I've had prescribed
Mhm.
ones, and then, you know, I've experienced dermatitis above the eyes because it was
Because
like
of
dry.
mhm.
Yeah. So I stopped that. And then I went to a more low key one. Then I just kind of changed mine recently, and I'm actually really loving it, but it's a gram active retinol. It's a
Okay.
2%. So it's, I get, yeah, there's so many different variations of
Different
retinol
formulations.
now.
Yeah.
Yeah. And it is, I'm actually really liking it. So, but yeah, retinol is definitely a staple. Is there a time period that you like, a starting point that you would say, for these
Age.
specific? Yeah, exactly.
So from retinol, I would say from age 25 onwards,
Okay.
really, young, but
Okay.
like say start with the lowest concentration and slowly build up
Yeah.
if you need to. And around the eye, you were talking about it. Actually, a easy way to apply it on the eye is once you apply all over your face and whatever you have on your skin, put
Yeah.
your eye cream on it to dilute it and then apply it on your eyes.
Okay, amazing. Yeah, apparently
Yeah.
that happened to me because it was just so dry where I was, and
Mm.
that combination made me react above the eyes. So interesting. But okay, amazing. So vitamin C, retinol, the niacinamide is great,
Peptides will
and
be good too. Peptides.
peptides. Oh,
Yes.
there's so many. Is there any specifically that you
No,
love, or
I love
general?
more like I love more multi-peptides because you can't have one. Then the peptides is really good because again, it's building blocks for your skin. You can add growth factors as well. So there's a lot of products you can have growth factors, and that's why a lot of people in the into regeneration they like to do PRP, platelet-rich plasma, because it's the way it's just growth factors from your own blood system.
Ooh, girl, you just took us right into the next phase of questions. Oh, so not that long ago, I saw this video of that you posted, and you were talking about microneedling, and
Yes.
so you say PRP, and I'm thinking of microneedling, and let's go into this region now of things because so I've had consultations. I've been curious. So okay, let me start by saying this again. I've never done Botox or fillers, and I'm in this time, this decade where I'm like, what could I do outside of my lifestyle? So the foods
Hmm.
I eat and the way I train, the way I rest, my skincare. Is there anything else besides my hydrofacial too, which I really love, that I could be doing that's not going in that direction yet of Botox or anything, but that just can help me to maintain the integrity
Hmm.
of my skin health and all that. And so I've heard about microneedling so much in so many positive ways. I want to
Hmm.
just say it straight up. It scares me. I mean, anything that you're doing to the face for me, I'm like, that's scary. It's your face. Um,
Hmm.
but the concept, and I've had the consultations, it's like, no, there's no, and I have very sensitive skin, like such that if you scratch, I welt,
Okay, so
right?
your histamine reaction is quite strong.
Yes, thank you. God, see the way
Hmm.
you just said exactly. So I'm like, how much downtime do you need? Plus, I'm a girl in the sun. Is
Yes,
microneedling really my jam? Like, please talk about that. And then I want to dive into other,
the treatments.
yes, thank you. Yes.
So microneedling is a form of collagen induction.
Okay.
Okay, it's a physical or mechanical collagen induction. Okay, by causing micro trauma to your skin to stimulate collagen production. You can have chemical
Hmm.
resurfacing, which is also collagen induction, depending on the peel. You can also have energy-based collagen induction, radio frequency, kind of fractional lasers. So microneedling is great for scars.
Mm,
Collagen, yeah, also good depending on what you apply as the glider. But because you're in the sun, there is higher risk of pigmentation. Your skin type also your higher risk of pigmentation. So that is the only
yeah.
potential downside. You can do smaller needles,
Yeah.
which just gives you a flush.
Sure.
and then you can use the PRP over it, because even if you do a PRP, which is a platelet-rich plasma, together with microneedling to
Yes.
enhance the absorption or penetration, you still need a good at least a week out of the sun, or 2 weeks really. And I know that will
Whoa.
kill you.
Well,
You
it's
know,
just that I don't even know how it's possible because even if I'm just,
yeah, I
I
understand.
walk all day, I'm in this and I wear my sunscreen, obviously zinc mineral sunscreen, but I'm
Yeah,
outside. I'm not an inside woman,
yeah.
So yeah.
It is possible, I mean, like for me, I'm very prone to pigmentation. However,
Mhm.
I have those treatments as well. So during those time, yes, sunscreen, but I also use products that prevent or inhibit melanogenesis. So kind of block the pathways of producing melanin, so to reduce the risk of post-inflammatory hyperpigmentation. So whichever clinic you go to, you would skin tweaks before to kind of stabilize the melanin so it doesn't go crazy after you have the trauma, and then continue the protocol 2 weeks after to stabilize it as well. So it just reduces your risk of PIH.
Okay, I'm just going to repeat because it was a little cutting it in and out. So you're saying that there's like the pre-work of a couple weeks to make sure that your melanin is not going to go haywire upon doing these treatments, and then there's the post
Correct.
work that you're doing. Okay. Well, yeah, and I love that you said that because I am prone to dark spots. If I get a pimple
Mm.
from it will and I don't touch it, like it can not scar, it just the dark spots just likes to live on my face for weeks. So just move in, like make itself at home. I'm like, I did not invite you. Get out of here. So
It's
I
protecting you.
just,
It's protecting you.
is that what it's doing? Well, and
Yeah.
then so I was thinking, I'm like, is that what it's doing? The other thought of, I'm not really a hydroquinone girl because that has been suggested because above my lip, you can't, it's hard to see, I'll wear concealer but it almost looks like I have that birth control hormonal dark spot that can
Melasma.
happen. Yeah, melasma above the lip. And I
Hmm.
have had suggestions of, oh, if you do some hydroquinone, but I've, from what I've learned about
I don't really like
hydroquinone,
hydroquinone. Yeah.
see, you wouldn't because it's a carcinogen. Is that
It's a carcinogen. Yeah. And there's unless you do it properly, there's a risk of rebound
right?
hyperpigmentation, which is worse, So,
Right.
but check out a product called Cispera.
Okay.
I can't remember the chemical name, Cispera. So it's not as harsh as hydroquinone, but you apply on the area 15 minutes and you wash it off. So
Oh,
every night you apply it and you wash it off. Again, whatever you use for melanogenesis, you still have to sunscreen and everything, but
yeah,
you check
yeah.
that out.
Okay, perfect. Yeah,
Cispera.
because thank you for that. Yeah, I'm on a mission with trying to, I've got the vitamin C and all the things. There's another acid, it begins with a T. I'm not going to pronounce it right.
TCA?
No, Traxel something. It's some specific acid that has been shown to reduce dark spots. Um,
Oh, I know what you're talking about. I can't
Trax,
remember it. I know
yeah,
what you're
it's
talking about.
Yeah, and I just started using a product that has it. So the jury's still out. I don't know yet, but that is for me personally a big and then that leads me to want to ask you about lasers because I know that Fraxel lasers could be useful as well for dark spots, but obviously texture, toning,
Scars.
scars. How do you feel? Are there lasers that you like? Are there things to be cautious? Yeah.
When your skin is prone to pigmentation, I'm very cautious, and sometimes they won't even touch you with the laser just because
It could, yeah.
you was like you say you are gorgeous and your skin is beautiful. There is you don't. It's I think that's extreme doing the laser. Unless you have scars, fine, then you can do it. But I
Yeah.
don't think you need it really
Yeah.
with the fractional laser.
Okay. Okay. So radio frequency, I've been hearing a lot about this too. I've actually been,
Yeah.
in a consultation. She was telling me about it as well. And it's so much more expensive than microneedling. And I'm like,
Yes.
why? Is it
Because of the
because it's
machine. The machine is
really?
expensive. So you're paying for the machine, really.
Wow. Okay. But this is a treatment that has essentially no downtime, right?
Essentially no downtime unless they really jack up the energy and it burns you, but
Oh.
it's less likely. It's really less likely, so it's a gentle heat
Hmm.
as they raise it up. So you're getting thermal thermal collagen induction.
Got it.
Right.
Yeah.
Okay. So you're
Yeah.
causing, yeah. So it's great The question is how long it lasts. It's great for before events. Perfect. You just, straight away you get this thermal collagen contraction and you
Oh,
just
really?
look great.
I love the way
So
we just went back.
yeah, it's great
For
for,
those watching, like, pull it back.
I know. It's great for, what's it called? Yeah, events. Just
For
before
my
events.
birthday? Do I need
Hell
to get
yeah.
it for my birthday?
Do it. Do it. Do it day before. Like ding.
That's right.
You are like 5 years younger. Ding.
I love
It's
it.
good. But the question is how long it lasts. It's
Yeah.
questionable because, like you
Yeah.
said, how much you pay, the upside is not that much.
Right. Yeah, she
So
said it depends on the woman that I was speaking to said, obviously it depends on your genes and your lifestyle, but it could last up to 2 years. And I was like, wow, okay. And when I think about this stuff, I mean, I'm thinking about the word hormesis. It's very similar, right? It's hormesis. It's like
yes, it's shock.
you're
It's a
right.
shock.
We do that when we go in, cold and heat, hyperthermic
Yes.
conditioning, ice baths and sauna. It's that same, I mean, even turmeric is a form of hormesis, right? It's
Yes.
putting that little stress on the body. So your body then,
S-
responds.
Absolutely responds to make it resilient.
Right.
That's it,
So that's
really.
with these
So the skin.
treatments.
Yes. Different,
What
like you say, chemical, mechanical, and energetic.
I love that.
Mm.
Yeah, chemical, mechanical, energetic. Okay,
And mhm.
yeah, no, please go ahead.
No, the energetic you can add the thermal if you want, but I put the heat under energetic. So
Yeah, heat is energy. That makes
yeah.
sense.
Mm.
What treatments are you loving? Like, is there anything that I'm not touching on? Like, I mean, we talked about radio frequency,
Talk
micro.
with our frequency. I mean, Botox we touch a little bit.
No, yeah, I want to talk about that as well. 'Cause, I mean, I kind of categorize them differently because in my mind, it's like, okay, the radio frequency, the microneedling, these are more natural, even though they are still,
Mhm.
more, it's not just like something that you're putting on your face, but to me, Botox and fillers, or, they're coming in on the surface and they're just, I don't know how.
You're inserting something
You're
basically.
inserting something. There's
Yeah.
also under eye, there's a treatment that it's called candula. What is it called?
Oh,
Where they fill in
the
the little,
teardrop.
yeah. I forget what it's called, but look for everyone watching, like that's, see?
You're fine.
Yeah.
Those are difficult to do because, like you said, when you smile, your cheek is pushing up the skin. But when you're
Yes.
relaxing, you don't have anything there. So the tear
Right.
trough is especially the first centimeter under your eye, and that's like the dip. It can be age because of kind of volume loss, but it can be just genetics that you have it.
Yeah. Okay.
Okay.
Well, okay, let's talk about Botox and fillers. I
Okay.
mean, yeah, go.
So I would say like because like you said, there's a lot of treatments,
Mhm.
but I like to break it down like an easy guide to non-surgical treatments. Kind of like, what do you want it to do? First of all, what do you want it to do? So first one, do you want to relax a muscle? Do you want to fill a line? Do you want to add volume? Do you want to lift, firm? Do you want to change your skin? Do you want to boost your skin? So it depends on what you want to do. Then you put your treatments in. Treatments come and go. There'll be new treatments, but it depends on what you want to do. So Botox can help to relax the line, like you said. If you got very strong frown muscles, then you have the 11s that you wake up with, or you have very lines on your forehead, crow's feet. So those are the licensed Botox indications.
Sure.
And then you can also do Botox. These are the non-licensed one for the chin, for cobbled chin. That's when you get the witch's chin, all the
Yeah.
little pots
The
and
little,
like
yeah.
little holes. So you can do Botox for that. You can slim the jawline, putting Botox at the masseter. You can do Botox in the neck to reduce your
Whoa.
turkey neck. So you can do Botox just in the side here to reduce gummy smile. So,
Oh.
so with the Botox, you can also adjust how high you want your eyebrows. So they call it a chemical brow lift. Okay, so let's say maybe you're not ready for surgery, upper blepharoplasty. So you can do Botox to lift your eyebrows a little bit, and
Mhm.
depending on where you inject, you can lift your eyebrows on the side or on the arch. So it depends on what you want.
I mean, it's such an art form. And obviously, I think like Botox is like Starbucks. It's like you can get it on every corner now.
I
Like,
know.
and that's kind of scary because obviously there's a lot of overdoing, which I kind of want to talk about with you too. You know, but so it's like, how do you know who to go to and where, like, I mean, where would you Botox me? Like, how do you, because here's the thing. It's like you said, it's not always, oh, there's a line there, so I have to Botox there. It's like you do it in these other areas that then affect other areas, if I'm saying that correctly. I've listened to
Yes.
some, yeah. What do we do? How
So how we've been taught is in a way inject by numbers, if you like. So
Yes.
like where to inject, how much to inject. But the phase, as we know, everyone is very different. The muscle bulk is different, and what you want it to do is different. It's dynamic. So it is an art form. So the technical, you can learn the technical, but the artistic approach, that's yes, you can have a flair for it. You can learn by experience, but again, it depends on your approach. So I think a good sign of who to go to, number one, have a look at them, have a look at their face. Do you like what you see? Because they will do their own Botox. Right? So that's a good indication. And also then you have to ask around, because it's easy to, before and after, it's easy to
Right.
what's the word called?
Tweak your
Ah,
pictures.
it's easy to, yeah, it's easy to tweak your pictures. Easy.
Yeah.
So you really have to just go by by testimonials and
Right.
recommendations.
Okay. And let's talk about the health of Botox. It's been shown that it's technically like safe. And talking to someone like you with your holistic approach and integrative, medicine, I really would love to hear your thoughts and what you know about the health of Botox, because I think about like the compounding effects, and especially girls are
Mm,
getting it so young. That's the thing. Like, my goal is like, okay, if I'm ever going to Botox, like, can you just push it out as long as you can? Because more than likely when you start, I feel like it's
mm.
something, unless for some reason you can't get it, you're likely going to stick to it. So then there's this compounding effect. How does that affect us in the body?
So I mean, I'm glad that in actually UK they just recently passed a law for it's 18 years old and below, they ban cosmetic procedures.
Good.
So that's just quite recent. And I think with the Botox so Botox has been used for a long time before being used for cosmetic use. They were used
Mhm.
for children with cerebral palsy, used for squints. So that was what it was used for muscle spasms. So when they used it for cosmetic, because it was actually by accident when they discovered that when they injected for squints, that they realized, oh, the frown lines actually improved. So that's when they explored it for cosmetic. The dose is actually much smaller than what you would use for children or for squints.
Mm.
Now, the question is when you use it too much, okay? So if someone is have very sensitive immune system, autoimmune, then I will be much more careful, or, kind of history of cancer. I'll be much more careful. Not to say that it has any research that shows that it affects it, but we don't know with someone who's got autoimmunity. We don't know,
Right.
what happens to it. But don't forget, when you relax a muscle, it stops working, so it actually shrinks. So, so again, what are you using it for? So in the olden days, or when it first became very popular, women are using or having it on their foreheads too much. So the forehead muscles, or the frontalis, is the only muscle that lifts your eyebrows up. So as time goes, the muscle shrinks. That's going to drop. What do? They need surgery to lift it up.
Okay. I love you, because and please, if anything that comes out right now, like if I'm not saying this, if you can combat it. Because
Okay.
personally, I'm so tired of hearing this sales pitch of it's preventative. Preventing what? What I know about muscles, as a girl who has muscles, who
Yep.
goes to the gym to have my muscles, if you don't use your muscles, atrophy happens.
Yeah.
And when atrophy happens, we go saggy, we fall. So if we're atrophying, if we're putting this Botox in to prevent, but really the muscle's not being used, so it's not flexing, there's atrophy that's happening. And if you
Correct.
stop that, then everything falls. If I'm wrong, please correct me. Because that's just like my logical, like, girl who trains and lift weights. I'm like, how is this? this is what they're selling. Listen, like sell all day of like, we're going to refresh, but this selling point that I've heard, and it's so, because when girls want to talk about, no, it's preventative. I'm like, preventing what? Your muscle
I know.
needs to be used in order to stay strong. So
Agree,
please.
agree.
Okay.
Okay. So,
I'm
I love
such a
this.
little sassy.
No, sorry, I love this. So you can have dynamic wrinkles or static wrinkles.
Oh,
Okay. So dynamic wrinkles are lines that come on movement of muscles. Static wrinkles are basically there whether you move it or not. Okay.
okay.
Botox will not treat static wrinkles because you're not moving the muscles. Okay. So, but when you get a line, when you move the muscle, then Botox can help because
Okay.
is you have a dynamic muscle. Now, what I always tell my patients to do is that you're breaking the habit of that muscle crunching as much, but
Mhm.
it gives you time to work on your skin, to build its resilience, to make it strong, so
Okay.
that when you next time moving it, you're not going to crease your skin as much. Okay, right.
Okay. Okay.
So that's kind of so I think the prevention, it depends on how old and whether they have dynamic muscles or not, really. But definitely if they don't have any lines, whether it's dynamic or static, no, definitely no.
No. Okay. I love that. Thank you for clarifying that because it's, yeah, like I said, I just feel like it's so sold to so many women and they're so convinced. Yeah, I'm just preventing. I'm like, no, it
But
doesn't work that way. Yeah.
it's interesting, when like the crow's feet, I don't
Yeah.
like it when they do Botox too much because when you're smiling, you need to smile in your eyes. Okay.
Yes.
When you're not smiling your eyes, you know about the Duchenne and non-Duchenne smile?
No.
Okay. I love it.
I
Okay.
love
So
this.
Duchenne's you're
Okay.
frozen again. Okay.
Oh no. Okay,
So
ready? Go.
Du- okay, good. So Duchenne smile is basically when you're smiling and your eyes smile with you. Okay.
Mhm.
The non-Duchenne smile is when you're smiling. It's a fake smile. It's like you're just moving your cheeks, like you're not smiling at all. So when you use Botox, like completely obliterate your crow's feet, you will get a
Yeah.
non-Duchenne smile, and it just looks fake. And then with that, people's reaction to you is in a way again, like we're talking about that positive
Sure.
mirror effect. They found that if you have a non-Duchenne smile, you're not going to get the same effect as a Duchenne smile because, again, it's not a real smile; it's a fake smile.
I love that. And it's so true. I'm thinking about some of the closest individuals into my heart in my life. And I say this to them, like, your eyes smile. And
Mm.
there's a warmth and a genuine feeling when you look at someone and their eyes smile. In fact, the times that I have talked to, the women for, consultations for like microneedling and if Botox came up, which I, just talking about it, one of the things that I've said is like, I would never want, even I've inquired because I have TMJ
Mm-hmm.
and sometimes when I chew, I literally can look in the mirror and I'm like, oh my gosh, your face is swollen, and I don't like it. It's like all of a sudden the jaw just gets more, so
Mm-hmm.
I've wondered about that,
Mm-hmm.
but I've been so I've talked to, the women in the consultations about that. But my big thing is like, I do not want my smile to be
Mm.
interrupted at all because I actually really like my smile. It's
It's
real,
gorgeous. It's
Thank you.
gorgeous,
It's
but
just real.
I know, and also like you say, your face, you have that angle in your jawline that
Yeah,
a
it's
lot
like,
of women would kill for. Okay,
really? You think so? Thanks, girl.
you can actually
Like,
do filler to actually create that jawline.
really? I just
Yeah.
want it to not get bigger. I'm like, can you just,
Yes, so you can potentially do Botox in the masseter, which is the jaw muscles, just very small doses, really,
Yeah,
But then you have, like you said, you have to go with somebody that just super tiny, just to relax it a little bit. And it's
yeah,
funny. I mean, like I say, I would do treatments myself before I do it on patients. And when I did Botox. So at the beginning, you learn on the top, the forehead, the eyes, and the
yeah.
frown, and then later we learn at the bottom. And I tried the bottom, but the bottom means the chin, the jawline, and the neck. And I did way too much. And it was funny because it was just early on of dating my husband, and I couldn't move my bottom lip.
I don't know. It's like, that's horrible. Wait, you can take Botox out, right? Or fillers out? Or no,
Yeah,
you can't take
filler,
Botox. Filler, you
yeah,
can.
filler you can dissolve it.
Got it.
But
Okay.
so Botox you need 3 months to wear off, but filler you can dissolve it.
Got it. Okay. There's so many things. Yeah, lip fillers, so many things. I mean, my goal, like first of all, obviously I'm very curious, but also, to have this conversation and to talk about these specific things with you for my own self, but also just knowing that there's so many women listening and, obviously some women, there's only going to be a lot of women who are already deep in this game, but, there's a lot of women too, I know who personally look to me as, I have a tagline, age like a badass, right? Which doesn't mean I'm saying you can't do these things, but it's more of like just owning your process of aging in a very robust, healthy, confident manner, right? So do the things that are going to optimize your health, your insight, your mental health, your physical bio, all that stuff, and then also be caring for the external as well. I mean, when I go to the gym, yes, or any form of training, I have many forms of training. I'm definitely, doing it for my health and for longevity, for performance. But there's also an aesthetic component that does come
Comes with
into
it, and
play.
there's nothing wrong with
Yeah.
that. Yeah.
No, exactly. So I'm definitely an advocate to say, like, do all the things that are going to help you to, age in a way where you feel really confident and badass. So, you know,
I
there
think
are
it comes down
women,
to that comes to intention. It's the intention. Why they have treatments? Do they
right?
need it or do they want it? It's a different. It's a very slight different, but an important one.
Yeah, because I mean, look, I mean, I think, if you're going in to do things because you're feeling very insecure about a lot, and that's actually a really sticky area too, because,
Mm.
there are people whose lives have changed, for example, because they did go on, they got the nose job or they fixed the thing. And that is a beautiful thing. Like,
Yes, I agree.
whatever, right? That no one's judging on that because, you got to live in you.
Oh, yeah.
Yeah. So, but where I was going initially with the age like a badass is I know a lot of women who also listen to the show, or, maybe they haven't gone there yet and they're wondering, like, what are my options? Like, maybe I'm not ready, like you, Roxy, to do the Botox or do the fillers or anything like that. Maybe I never want to be. And personally, maybe I never will. But so what are these other things that we could be doing? So something that I've recently fallen in love with and I want to talk to you about is the gua sha. We have jade
Hmm.
rollers, gua sha, now the stone where it's like the ancient Chinese stone. Do you like gua sha? Is there anything that
Hmm.
you don't?
I do
Yeah.
like gua sha. I actually was, yeah. I mean, I actually was gifted a beautiful gua sha by Yina, a beautiful company. So I'll be using that, but mostly using I'll be doing a video on it as well later. So that will be quite good.
Yeah.
But with the what's that word called? I'm trying to think because we're talking about natural things that what we can do if you like.
Yeah.
I mean, I believe in face yoga. I
Face
believe in face
yogurt.
yoga, but you need
Oh,
face
face
yoga.
yoga.
Face yoga.
I'm seeing so much of that. And
Yes.
yes, please, let's talk about face yoga. Skin
Yeah.
gym.
So face yoga, absolutely skin gym, Again, face yoga is kind of like how can you activate those muscles that lifts,
Mm.
okay,
Yeah,
and then also relax the muscles that draws your face down and makes it angry. So that's kind of like the whole concept of face yoga. How do you harmonize your face? But again, those you need to be consistent. You need to be diligent. Like going to the gym. So
right,
not every woman have that patience.
right,
So it's great for maintenance with the facial yoga, but it needs time to build it. So some women, like I said, they just want a head start. Maybe they don't have
right,
treatments for a head start, and then they maintain it, with something else. So it's not like once you have it, you will have it forever. But maybe it's just a head start to
right.
get
So
you. It's like a boot
moving.
camp, if
It's
you
like
like. It's like a boot camp.
I love that. Yeah, because I see so much on Instagram, so many lymphatic draining, techniques and this and that's I mean, is there any downside or things that could go wrong with this kind of, you know,
Manipulation.
thank you. Yes.
Yes. Facial manipulation. Yeah, facial manual manipulation. I think that's better rather than, yeah, facial manipulation. It depends again, if they've got infection, so they've got active spots if they've had cancer. So you guys got to be very careful. Sometimes they might be maybe putting too much pressure, then you might sensitize the skin a little bit. So again, you just got to be very careful where you're draining it down to.
Okay. That's amazing. Okay. Can we talk? I want to ask you, my high frequency, the wand for antibacterial.
Oh yes, I love that.
Do you really? Does it
I
do
love
anything
that.
more than just, is it like for here, antibacterial, or is it
No,
does
it's
it,
just antibacterial. It's just
oh,
it's like
okay.
it's like an ionization. It's like an ionization thing, really.
Oh,
So
okay.
and then it's it what's it called? Yeah, because when you do it, you smell the ionization of the oxygen. You break
Yeah.
down. I go, yeah, I love it. It's a classic OD, but it works.
Yeah, I have it, and sometimes if there is a little breakout, I'll
Yeah.
use it. So I was just curious if there's any other magical things about it. Okay. So I have asked you a million questions, and you're so generous, and I adore you, and I appreciate
Oh.
you so much. I want to ask you if you had a magic wand and you
Hmm.
could give the masses in the world, men and women now, one positive habit that would have a large ripple effect on their lives, what would it be and why?
Master your sleep. Get good quality and quantity of sleep, basically. Solve so many problems.
So many problems. I mean,
So many problems.
I literally looked at this morning. I only got an hour of REM. Not that cognitively sharp today, but and I looked at my skin and I was like, there really is such a difference on the days that you wake up and you really got high quality, great sleep. So we're not just talking about hours, we're talking about your
Yeah.
deep, your REM.
Yes.
Your skin just looks happier, like perky. And then those days
Because
where
you're
you
you're
don't.
detoxing. You're detoxing and regenerating at nighttime because you're producing your growth hormones at night, so it's regenerating.
Okay, and then let me ask you. So you said producing growth hormones at night, but that does
At
depend on
night.
what hours you're going to sleep, right?
Correct. Yes.
Because a window, because some people are like, oh, but I'll go to bed at 1, but I'm waking up at 10. But I'm like, yeah, but you're missing
Yes,
that.
because you have more cortisol.
You have more cortisol. Oh my gosh. Okay. So many things. Hormones. Can we touch? I just want to ask you a little bit about that because I know that you specialize in hormones. Is there anything that
Mhm.
you want to talk about in the realm of hormones to live in this conversation that, can support women, in terms of their, like, is there, because hormones is a universe. I mean, that's a
It's
big
yeah.
subject.
I mean, we can do potentially another podcast on hormones itself, really, as you know, but hormones with skin. But I think the biggest one that everyone we should focus on is cortisol, not just because of stress it does at the body, but also stress in the skin. And actually, on our skin has actually receptors and actually can produce its own cortisol, can convert cortisone to cortisol to activate cortisol. So
Wow.
so they found that, we talk about the HPA axis in the body. There is actually like a HPA axis in your skin as well.
Really?
Yeah. So, and they found that because it's a peripheral cortisol production, it's more inflammatory
Wow.
compared to the, more, what's it called? More centralized nervous system that's more anti-inflammatory.
So then to help the cortisol aspect of your skin, I mean, is this more of a lifestyle?
Yeah, lifestyle is important, and
Yeah.
also the products that you apply as well. Stress, stress is such a big thing. Sugar regulation, because if not, then it will affect how your skin heals, how your skin repair, how your skin regenerates. That's all affected by by cortisol.
What does beauty mean to you?
Ooh, such a big
I
word.
know. It's like I just threw you in at the last
I
minute.
know.
Like,
Oh my God. I think beauty is loving yourself, but in all its glory and flaws, really. I would, yeah, that's beauty for me.
just all of you, like owning
All of,
yourself.
yeah, just owning yourself. Whether you like something or not, it's just own up to it and it's okay.
I love that. You are we have to do
Oh,
more. We for sure. You're like yeah. I want to actually do a podcast where we're just diving into the hormone aspect because I know that's also a big part of your expertise, and it is such a big, important conversation, as it relates to all things health and beauty. So, I would love to
I would
have
love
that
that. Oh, bless.
Yeah. So I know we talked about a lot of things and I'm so grateful and I can't wait to do another podcast with you and just have more conversations with you. But I do want to ask you, is there anything that we have not touched on yet, or even something that, you wish you were able to speak more on, or like people asked you more about, or you just want this piece to live in this amazing conversation? No worries if not, because we did touch on a lot of things. But if you do have something that you want, like a closing statement, I'd love to hear it.
So the reason why I want women to feel confident about themselves is basically I'm trying to create a better future really for my son through the women I meet. Because when women are confident, it will just encourage and influence positively with the girls that will be coming after us. So they're going through so much pressure, to be a certain way. And we want them to find their voice. And it's difficult. And I always feel that girls, acne is not just scars and external, but it's also scars internal.
Yeah.
So it's kind of like, how can we help the younger generation by being confident ourselves, really, so not just focusing on now, but focusing on the future generation and our world.
I love that. And I think it's
Yeah.
so important. We are a collective and
Mhm.
we don't want to just be thinking about us and right now. We have to be thinking about those coming up behind us and what they're experiencing and how what they're experiencing is going to do
Mm.
for the trajectory of their lives. So it is like a kind of human responsibility, if you will,
It
to
is.
yeah, totally. No, and it's, and listen, and it bridges me to this piece that I share with all of my amazing guests who come on, and it is this moment to just say thank you for being such a powerful contributor. I mean,
Thank you.
even in that thought process, but it obviously extends beyond just your thoughts and your ideas, but you are a contributor. The way that you show up in the world for yourself, for your personal life, for your clients, for your community, you're contributing. So I'm so grateful to be in space with you, to have you on the show, and to officially be new friends. And I just, yeah,
Yes.
yes, I adore you. And so I would love for you to share. I know that you have a membership. You have things going on for women to stay connected, to work with you when you come to the States. I mean, I'm just saying we have to hang, or I'll meet you in another part of the
Yeah.
world when the world calms down. If
Yes.
anybody's touching my face in any way, I'm saving this. This face belongs to you. I said it out loud on the podcast. It belongs to you.
Oh, bless you.
I trust you.
Oh my god.
You're not going to give me fake smiles.
No, definitely not. Oh my goodness.
Oh my
Okay.
goodness.
So, I mean, the best way to connect with me is through Instagram. Dr. underscore Terry underscore. And at the moment now, I'm creating a program to help women in their 40s. So kind of like fabulous 40s, going through hormones, skin, and then later on a membership afterwards. But but the best way is to connect with me Instagram. And if you would like, because I do virtual consultations, and if you need
Mhm.
help with skin or hormones or advice, I also do that at the moment.
Okay, beautiful. I love that. Everything will be in the show notes. Yeah, I love your IG. Your content's so fun. It's so
Oh,
informative. You know, oh, so many things. Your live IGs. There's so many things. For everybody needs to go get dialed into you on Instagram. Thank you so much again.
thank
This
you.
is not goodbye. This is to be continued. So thank you so much, beautiful.
Uh, Thank you very much.
Thank you.